Okay, we're just scanning the room for you before we begin our NG tube insertion. Okay, so the first thing I would do is explain to the patient the procedure of the NG insertion process, why they need it, why the doctor ordered it, and how it is going to relieve their pain, discomfort, or other symptoms. So, after I've explained to the patient what is going on, and that this is a clean procedure, not a sterile procedure, but it is a clean procedure, we would provide adequate lighting in the room. We would raise the bed to the appropriate level. And then we would also pull the curtain and we would provide patient privacy. So the first thing I'm going to do, my doll here is very, very small, so keep that in mind. I do realize that we would tube a normal person with a little more length of the tubing. First thing we would do is cover the patient with chucks. And here's an emesis basin and Kleenexes I have, just in case the patient was to have a large emesis during the procedure. Okay, and then we would, here is the NG tubing. And the first thing we're going to do is measure. Okay, so you measure from the tip of the patient's nose to the earlobe, and then from the lower earlobe, the tip of the earlobe, all the way down to the xiphoid process. So for a normal person, it would be something like this, but I'm going to do it on my doll here. So I measure from her nose to the earlobe, and the earlobe down to the xiphoid process. And then we would mark that with a piece of tape. Kind of a measurement just for guidance. We're going to do some more checks here in just a little bit. Okay, so after we've done that, we'd also want to create a little more of a coil in the top of the tubing, because that is the way that the normal nasal passageways, natural passageways, are shaped. And then we would assess which nair you would want to use, assess for any anything that would cause problems like septum or any abnormalities. So we're just going to go with the left nair on this patient. Seems okay. So we are going to add about some lubricant, about the 3 to 4 inches here. Okay. And then we would start by the patient looking straight ahead, and we would just put the tubing in the first nair until either right before or just when the patient starts to gag, and then you would let them rest and take a little break. And if you had an assistant, this is where the assistant would get the glass of water, and then there would be a straw. I don't have straws to show you, so there would be a straw here, and you would encourage the patient to drink, drink, drink for this whole next step here. So after you get it in, and then the patient has the water at their disposal, you would want them to lean their head forward, tilt their head forward just a little bit, and then using 2 hands to advance the tube, all the while encouraging the patient to drink, 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 and you would continue down like that. This is my taped mark for my doll size, so I'm just going to stop there. And then we would apply a piece of tape here with a double slit here, just to keep the tube temporarily wrapped, one strand around it so it's temporarily secure while we do our extra checking here. Okay, and how we would do that extra checking, I've already put in my my clamp here, the reflux blocking clamp there. Okay, so we would need about, the first way we're going to check is about 5 to 10 cc's of just air we're going to put into the tube here. So we would want to clamp the tube here, take this off, and insert the air while listening with your stethoscope to the fundus area of the stomach. And you insert the air, and you should hear a whooshing sound. And if you do not hear a whooshing sound, if you hear the whooshing sound, you're in the right place. If you do not, you can continue to aspirate some stomach fluid out of the tube here. Just a little bit, maybe 5, maybe 10. And then when you're clamp to do that. And then when you're finished with that, you would clamp, and then possibly clamp it like this too so that nothing else could come out. And then you would bring your sample over to the side here. I'm going to pretend like this would be my pH strips. I don't have any pH strips. And you would test the pH of the acidity of a stomach, the fluid that was aspirated from the stomach. And if it is less than 4, then you are in the right area. Okay, so now that you know that you're in the right placement, you can continue to, my dog's face is kind of small here, but wrap the second part of the slit tape and secure the NG, or tighten the NG more securely so it does not move. Okay, and then we would then hook it up to the suction tubing. I'm going to clamp it here just to take this part out. I don't have suction tubing, but you would bring the suction tubing from the canister and you would clip it onto here, and it would be at intermittent suction, low intermittent suction. And then we need to get the tubing, the NG tubing, off of the stomach wall. So we would need to get our syringe, remove this reflux valve here, and about 5 to 10 cc's of air. This is the only time that you put air into the blue tubing. And you just do it like that, just to remove the tubing from the lining of the stomach wall. And after you have done that, you continue to make the patient more comfortable. After this is secure here, we've already done that, and then possibly pinning it to the shoulder of the gown to making the patient more comfortable and possibly a little more independent in their movement. And that's all for the placement of the NG tube.